So, today's topic is contraindications for root canal treatment.
Yes, sir.
So, first of all, what is the meaning of contraindication?
Not allowed.
Means any procedure is not advised to do in a particular situation or circumstance. Should be avoided. Why? Because we should not harm the patient. That is contraindication. Okay. I want your view on this. By doing root canal treatment, what could it harm in any specific circumstance? If you are saying uncontrolled diabetes, if you do root canal treatment in uncontrolled diabetes, what could be the side effects, adverse effects? It can go with the patient. In case of in third trimester of pregnancy, people say, sir, I will avoid doing root canal. You come up with the specific answers. Why we should not do in third trimester of pregnancy root canal treatment? Why? Any reason?
Because you induce stress in the patient.
Third trimester, if you are saying you should not do, means you should have specific reasons.
Yes, sir.
Otherwise, you should not tell that. Simply, we should avoid. So, as per my, there are no absolute systemic contraindications for doing root canal treatment.
Correct.
Maybe there are relative contraindications. Relative means we should take proper protocols and we could postpone the treatment and we can do root canals. Like in recent cardiac surgeries, postpone the treatment for a few months and take your cardiology advice, we can do the root canal. In highly uncontrolled diabetes also, is a relative contraindication. There is no absolute that we should not. I say, if you're doing, instead of extracting the tooth, if you are saving the tooth in highly uncontrolled diabetic patient, you are providing service to the patient.
Correct, sir.
Compared to extraction, service,
Correct.
Service. In highly uncontrolled diabetes.
Same thing with even hypertensive patient and infective endocarditis.
Anything, there are no absolute contraindication. Relative, we have to follow some special protocols and we can postpone it. We can do the root canal treatments.
Bleeding disorders, sir?
Bleeding disorders, precaution and protocols, even in first and third trimester of pregnancy, there are no contraindications. There are no systemic contraindications for
Root canal
Root
treatment,
canal
sir.
root canal treatment.
Right.
So you mean to say,
See,
sir,
if you are saying me, if the patient is having some HIV like that, in that HIV also, follow the precautions. Follow protocols, special protocols. See, HIV means not every HIV patient, active HIV patient, where there is a stage of the disease where through saliva will transmit to dentist. On that cases, you take the special protocols. See, I am saying is systemic. There is no absolute systemic contraindication. If you have any, as per my experience, I am telling you, if you have any, you come up with specific reason so that it is debatable. Okay.
Okay,
Yes,
sir.
sir.
Got it,
So
sir.
coming to the local, what are the local, coming to the local causes, local situation, where any local causes, do you feel any local causes where there are absolute contraindication for root canal treatment?
There is no.
Sir, there is vertical root fracture.
Very good. See, if we are doing treatment to the root, means root canal treatment, we are dealing with the root. If root is vertically fractured,
Then it is no.
it is absolute
Correct,
contraindication.
sir.
So what about horizontal root fractures?
See, horizontal root fracture. Suppose, see, horizontal root fracture is at the cervical level.
हाँ sir.
Yes, sir.
Still we can manage. It is not an absolute contraindication.
sir.
We can do crown lengthening procedures, put post and code, we increase the crown height. So we can do.
Right.
What about the
Cervical.
apical third, sir?
Apical third also manageable. There is
Manageable.
no need of avoiding root canal. Apical 1/3 lesion itself heals up.
Heels up, correct.
Horizontal apical root fracture, hairline root fracture of the apical third. There is, I feel there is no such thing as
correct.
contraindicated. We can go with
We can go with
the
yes.
root
Correct,
canals.
sir.
Depending upon this, also I am telling this depending upon your wisdom at that point of
Ah,
circumstance.
Correct,
You
sir.
feel. Take other considerations also.
ah,
Take consideration of existing occlusion,
sir.
how it is, load bearing area, how much it is. Take the root length ratio, how much is the root length.
Ah, sir.
Take oral hygiene as a consideration. Patient का oral hygiene कैसा है वो देख लो.
So that means if we have the root length into consideration, that means if a horizontal fracture occurs in the middle third
Middle
of the
one
root,
third,
then
I
it
feel
is
it is
contraindicated.
no, it is absolute contraindicated.
Okay.
Middle one third, take any this thing, it is absolutely contraindicated.
Correct.
Okay.
See, first one is, I'll repeat, horizontal root fracture at the mid root level.
Yes, sir.
When vertical root fracture, any vertical oblique root fracture, contraindicated. Third is extensive external resorption, unmanageable extensive resorption. So unmanageable, I am telling means extensive, where you cannot perforation defects are can't be with the open. If you open the flap also, if you seal the defect also, it is of paying waste. Unmanageable extensive root resorption is an absolute contraindication. Local causes I am telling.
Internal resorption, sir?
Internal resorption you can manage. So
Can
many
manage with MTA.
material with MTA has come.
Okay,
Okay.
okay.
Then your bioceramic filling materials has come. With that you can manage. Internal resorptions manage. That too depending upon whether it has perforated or not.
Correct, sir. Correct.
Okay.
See, if internal resorption is perforated your root from inside,
Then you cannot proceed.
then it is waste of time only.
So extent of the
Is
resorption.
it-
Extent of the internal resorption.
Okay, sir. So any other?
Then coming to resorption is over. One more thing I want to tell you, highly periodantally weakened tooth.
Huh.
In that also periodantally weakened tooth, see the bone level,
Bone level, mobility.
mobility. I will absolutely say absolute contraindication is bone level.
Bone level.
Bone level. If the bone level is not favoring in favor of this thing, don't do the root canal treatment.
Okay, sir.
Okay, bone level is very important. Instead of saying periodantally weakened tooth may be due to many reasons. So we can do with periosurgeries, perioendo lesions. I have mentioned in my book. Perioendo lesions, if bone support is very good, okay. Artery weakened tooth, with respect to root canal means bone support, we are dealing with bone support.
Okay, got it, sir. Got it.
Okay, right?
Yes, sir. Got it.
Then treated tooth, contraindicated. Contraindication is if you have put large posts, large posts, where you cannot, already it has, you cannot manage. After removing also there is a lot of root has got
Separate.
weakened.
Weekend.
That time is a, in that also large posts also weakened is not absolute. You can see posts also. With the narrow post they have put, you can remove the posts. You can manage. You can manage.
Sir.
Okay, large post is contraindicated as per my
That
experience.
is re-RCT you're talking.
Re-RCT I am
Re-RCT.
talking.
Okay, sir.
And transportations. Unmanageable transportation above the mid-root level or
Okay.
cervical 1/3 level.
Perforation.
That is absolute contraindications. And zipping.
Zipping.
Zipping also nowadays we can manage, but that we have to decide on the patients. Other factors we have to take into the considerations.
Correct.
Okay.
Okay.
In my book also, No Endo, Do Endo. This is a beautiful book. How to manage each and everything, systemic causes, local causes, and medical. How to take medical history, because diagnosis is very important. I have mentioned it. You can refer if you have any doubt. You can
Sir,
ask.
have you mentioned even transportation and
Transportations,
zipping, what you
each
told
and
in the book?
every in zipping, transportation, I have mentioned in contraindication of root canal treatment.
Oh, okay.
Okay, anything else?
No, sir.
No, sir.
No, sir.
Done.
Thank
Good.
you, sir. Thank you so much, sir.